All right, let's get started. Good afternoon, everyone, or good morning, wherever you're tuning in from. My name is Ashley Cruz, and I'm the manager of community engagement here at the Mental Health Foundation. So before we begin, we would like to acknowledge that what we call Alberta is the traditional and ancestral territory of many First Nations, Métis, and Inuit, who for generations have lived on and cared for these lands. Our work takes place on historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and a portion of the Métis homeland, including regions 1 through 6. Since we're in a virtual environment today with attendees from all over, I would also like to acknowledge that no matter where you're tuning in from, we offer respect and gratitude for the land. We are really excited for today's session, which is aptly titled Beyond Stigma, using recovery-focused language to support mental health and addiction. Together, we'll explore the importance of recovery-focused language, the detrimental effects of stigma, and practical strategies for fostering support and inclusion. Our hope is that you walk away with easy-to-implement action steps to reduce stigma and make a positive difference in your own families, workplaces, and communities. So if you enjoyed today's session, please let us know. There will be a short 5-question survey to capture your feedback at the end. So we do read every response to ensure we continue improving these sessions. So please fill that out if you feel inclined. Now, I'm pleased to turn it over to our platinum sponsor, Ellis Dawn, who was our presenting partner for our 2024 Lunch and Learn series and has generously returned for our 2025 series. We're so grateful for Ellis Dawn's support, since we truly couldn't do this without such a dedicated partner to make all of these sessions possible. So now I'll hand it over to Connie Ellis, Director of Mental Health at Ellis Dawn, to say a few words.
Thank you, Ashley, and good afternoon, everybody. Thank you so much for having me. Despite my last name being Ellis and now working at Ellis Dawn, there's no relation, there's no nepotism. I did not get the job because of a family member. But I'm really pleased I've been with the company for about 2.5 months. And I'm really pleased to see these types of partnerships. I've worked at various mental health facilities throughout Canada, more recently at CAMH, Center for Addiction and Mental Health in Toronto, and then I was with TELUS Health for a few years out in beautiful Vancouver, British Columbia, before moving back to Ontario. So it's interesting as we talk about this topic today, because much of why I think Ellis Dawn, being one of the largest construction companies in Canada, is really pioneering and acknowledging the significant impact and rise of a mental health crisis in this industry. I think we're seeing increases among all industries, but this is really, in the last few years, I think, where we're beginning to talk about this in a predominantly male industry that has been riddled with addiction and suicide. And so some of the, staggering statistics, and I know that, depending on how you're measuring them, but we see anywhere upwards of around 80% of construction workers reporting a mental health issue within a given year. And yet, as well, self-reported, around 70 to 80% of those individuals won't reach out or talk to somebody because of stigma. So I think it's really important, as we talk about this today, regardless of what industry you're working in, just to be really cautious of the language and the impact that has on people around stigma. So I'm going to pass it back to Ashley, who's going to introduce your speakers today, your facilitators. But thank you so much for tuning in. It means a lot to me that you're here, and hopefully I can return again.
Thanks so much, Connie. We're so happy you're here personally, as well as representing Ellis Dawn. So thank you for that. Now I would like to introduce our wonderful facilitators. So this Lunch and Learn session, and all of our previous ones as well, have been facilitated by Anissa Gill and Kathy Mercier, who are both health promotion facilitators with Recovery Alberta, professional practice and education services here in the Edmonton zone. Anissa is a registered social worker supporting adults and older adults who face mental health and addiction challenges. Anissa is also a sessional instructor at MacEwan University in the social work program. And Kathy brings experience in providing community support and psychoeducational materials to children, youth, adults, and families in the areas of mental health and addictions. So welcome, Anissa and Kathy. I'll pass it over to you.
Thanks, Ashley. Thanks, Connie, for the lovely introduction. So we'll get started here. Okay, so we're excited to welcome you to today's virtual session, Beyond Stigma, using recovery-focused language to support mental health and addiction. So this session is brought to you through Recovery Alberta Professional Practice and Education Services team in the Edmonton area in partnership with the Mental Health Foundation. And as Ashley was saying, my name is Anissa and I'm a health promotion facilitator with the team. And my background is in social work, supporting adults and older adults who have struggled with addictions and mental health. And my co-presenter today is Kathy. Kathy, feel free to do a quick, lovely introduction of yourself.
Thank you so much. Yeah, I've just supported different community agencies in Edmonton before coming to this team. And I'm so thankful that you're here to be with us today. And we're going to have that conversation around the language that we use when we're talking about mental health and addictions. And so I'll be joining you more in the second half.
Great. Thank you, Kathy. So in this webinar, we will discuss ways we can commonly talk about mental health and addiction issues and how this can impact a person's recovery. We will explore the importance of recovery-focused language, the detrimental effects of stigma, practical strategies for fostering support and inclusion. So we're going to have a little bit of examples and polls throughout the session just to get a sense of where everyone's coming from. And we'll offer ways to shift from deficit-based to strength-based language and consider the role of harm reduction in recovery and discover everyday actions that can reduce stigma and make a positive difference in the journey towards wellness. So this information is designed for educational purposes only. So it should not be used in place of medical advice, instructions, and/or treatment. If you have any specific questions, please contact your doctor or other healthcare professionals. So in today's session, we will look at the power of words, do a quick review of stigma, dive into recovery-focused language, and then lastly, look at the impact of using respectful and empowering words in mental health and addictions. So if you have a pen and paper handy, it might be helpful just to jot down a few notes. And since we're talking about language today, we want to note that recovery-focused language may also be referred as recovery-focused language or recovery-based language. So for us today, it's all the same. We're just taking a look at choosing words that can positively support the journey of recovery in mental health and addictions. So with that, we're going to start a quick video here before we begin. It's a clip from the UK illustrating the power of words and the impact of those words on we perceive as a person's challenges, their reality, and how they're perceived by others. The words we choose reflect our attitudes, how we value people, believe in, and genuinely respect them. So please be aware this video does mention some offensive words that are used as insulting and derogatory slurs. Just keep that in mind. Here we go. Oops, sorry.
I've heard the word weirdo used a few times.
Weirdo's used quite freely, I think, I would say.
I've heard weirdo a lot in school.
Pretty much every day.
I don't even know why you would use that word to begin with, to be honest. Define the word at the end of the day, you know, is anybody really a weirdo? We're all individuals. We all face different things in life.
If I was called a weirdo, I'd feel uncomfortable.
Weirdo's not a word that sits well with me.
Mental, probably once a day, more than once a day.
In various different ways towards people that may have mental health problems.
I've heard the word mental used quite openly as well.
People say it like, oh, that's mental, that, or you're mental. It's used in everyday language now.
It's wrong to do that, and it makes their self-esteem even worse.
Such a simple word, but if used in the wrong way, it can really have a massive impact.
Say that to an individual that may be struggling mentally could be quite significant.
I personally didn't think it was a problem until I encountered other people who completely, that word made them feel very uncomfortable.
I've heard it a lot of times.
In the last week, I've heard it quite a lot, actually, from people that I know.
The individual that's used the word probably doesn't really know much about what that person's going through in life.
I understand it now to be quite a derogatory word, that some people aren't aware of how it can implicate different members of the public and young people in general.
Having that dialogue means that people can kind of have their awareness and kind of maybe choose different words.
But it does surprise me that people think it's okay to use them in the way that they do. Some people do use them in a negative way and in quite a derogatory way to people, to hurt them.
There's a lot of people out there that are completely blind to how many people in society do actually suffer.
If you look at things like race or sexuality, a lot of derogatory words were used in the past that we would simply not accept now. So I think with mental health, the awareness is just not there.
They probably don't fully understand or know enough about mental health.
Yeah. Again, just a great video illustrating the impact of the words we use, right? Particularly around mental health and addictions, and how it can affect a person's self-esteem, how they view themselves and others around them. Right? So a great introductory video in our topic today. So keeping that in mind. And throughout our session today, we're going to be talking about the power of our words and how the language that we use to talk about mental health and addictions can actually shape the path towards wellness and our journey to recovery. And with this, we're not just talking about concepts or opinions or theories. Our words have the ability to put up or tear down barriers, increase or remove access to supports, and increase or decrease our own agency or capacity around our health. So the words we use don't just float around us abstractly. They actively influence and shape our personal identity, our relationship to others, our views about what is and what's possible in our lives, our communities, and our words. So a bit of a reflection activity here, just to keep to yourself or to think about or ponder. How have the words of another person shaped your life? How have the words of another person shaped your life? So maybe when you were growing up, someone close to you, like a parent or a caregiver, used words of love and encouragement that you carried lovingly and that have equipped you to keep you going through life's challenges. Or maybe you remember words of anger or criticism that were said to you a long time ago, but they still take up space in your mind and show up in unhelpful ways. Maybe even the words of a teacher or helper or a friend were just what you needed to change the trajectory of a tough situation. Or maybe even there was a book you once read that helped you see new things in a new light, or maybe even gained a new insight just from reading a quote. So again, that reflection, how have someone's words shaped your life? So speaking of words and quotes, here's one that really resonates with me. So words are important. If you want to care for something, you call it a flower. If you want to kill something, you call it a weed. And that comes from Don Hoyes, the recovery counselor. Beautiful quote. So you can see how language has power and how we can choose to use it for our power for good. So we can be intentional around what we bring to our conversation, from the way we speak to one another, like when we're using someone's preferred pronouns, names, or including land acknowledgements. So our words do matter. They demonstrate understanding, respect, compassion, which can then lead to possibility, connection, and empowerment. And so this is important in every interaction, but especially important in the world of mental health and addictions. So when we're supporting others or ourselves on a journey towards healing and wellness, how we talk about that journey can impact our capacity to give and receive care. So stigma or prejudice is when we have negative and an unfavorable attitude towards something or someone. So when we use language that is focused on problems, on labels, limiting expectations, or guided by incorrect or outdated understanding, this is stigmatizing. So stigma causes those living with mental illness or addictions to be labeled, stereotyped, or feared. And maybe you're already familiar with common misconceptions around mental health and addictions, right? So what have you heard? So I'm going to bring up sentence starter, and maybe in the chat, if you feel free to care to share, put in the rest of your sentence based on a myth or incorrect belief on something that you've heard that increases stigma. Okay, so I'm going to start with the first sentence here, and you'll finish it off in the chat. So people with depression are just. So share in the chat the rest of that sentence. Yeah, lazy. Yeah, faking it. Dramatic, making excuses not to do anything. Weak-minded. Okay, yeah, so we get a sense of what that looks like. So let's take a look at another sentence here, and you'll complete it. She says she has anxiety, but I think she just needs to. And complete that rest of that sentence. Yes, suck it up, calm down, or just relax. Yeah, she just needs to focus, work harder. Oh gosh, get over it. Yes, yeah, do it. Realize things could be worse. Yes, yeah. So you're coming up with really great sentence enders. And so some of those are really, they're heard by people and they're no deal. Let's take a look at another sentence here, quote. So people who take meds for ADHD are, complete that sentence. Zombies. Yes, hyper. Overactive, right? Not trying hard enough. Maybe they're dumb. Yeah. Just bad. Kids, people who take meds for ADHD are over medicating. Yes, right? So again, you can see those common words around stigma that are used. And lastly, I think we have one more here. People who use substances are just. So complete that phrase. Right? Losers, right? People who are substances are just losers. They're dependent. They're weak. Right? They're no good. They're avoiding reality. Yeah. They're not able to handle themselves. Maybe they're making bad choices. Right? People who are substances are just trying to cope. They're looking for escape, looking for excuses, lacking in willpower, right? That's a common one as well. Right, thanks everybody. I can see, either you've heard about this or seen it written someplace, but yes, stigma still exists, right? And so you can see those phrases on the screen or those sentences that, yes, people are living with the reality of mental health and substance use and addictions, and how we address and phrase our words can be impactful, right, around that stigma. So again, thank you for sharing. As you can see, language comes from broad assumptions that judge and blame while invalidating the individual and dismissing the complexity and diversity of addiction or mental health challenges. And it can lead to discrimination at that personal support or service level, and even at the systems level where policies are made, right? Words are impactful. So it's interesting that we often have these incorrect assumptions or opinions of mental health or addictions, but we seem to have more understanding towards other health issues. So in this carton that you see on the screen, we see someone who's having a physical health challenges, being told, why don't you just try harder? As if their broken bones could get better with a little bit more effort. Of course, most people wouldn't expect this with such a physical challenge, but somehow with mental health or addiction challenges, we sometimes expect this. Why don't you just try harder? So reducing stigma involves gaining understanding about mental illness and addictions, like we're doing today. And we can reduce that stigma and raise awareness and connect with empathy so that we can be more supportive with those who are experiencing addiction and mental health challenges, including ourselves. And then we shift more towards the conversation with a recovery focus, using that language. And the more we connect with a whole person, rather than just their challenges or illnesses or issues, right, we can, again, focus on recovering. So let's watch a video that talks about stigma around mental health from people who have experienced it. And so be aware in this video, suicide is mentioned.
Hello, my name is Henry Boyd Jenkins. I have a diagnosis of schizophrenia.
I had depression. I had a miserable, horrible life for many years.
I also happen to have been diagnosed bipolar 1 disorder.
I'm also someone who suffers from chronic schizophrenia.
I suffer from borderline personality disorder,
major depression and anxiety.
I live with bipolar disorder.
My dad suffered from depression and anxiety.
My sister has bipolar disorder, and my nephew has schizophrenia.
Mental illness strikes with a two-edged sword. On one side are the symptoms and the stress and disability.
My dad committed suicide because of those feelings of anxiety and depression.
So I went from practicing law on that Friday to being in bed for a number of months.
On the other side, though, is community's reaction to illness, the prejudice and discrimination that makes up stigma.
Stigma happens because they're members of a group that are feared, despised, loathed.
Stigma sucks.
Stigma has impacted my own confidence.
I just thought I was abandoned, ignored by people. I've come to learn that it's a very common occurrence with people with mental illness.
The stigma, the version of what it is to be mentally ill, has cost me 2 of my siblings out of 3.
It's woven into the fabric of our society, and it stems back centuries, really, when mental illness was considered a character flaw.
There's such a bad stigma attached with having a mental illness or showing a symptom of it, and it's just not okay. Not in the high schools, not at all, actually.
Every life is touched by mental illness.
It doesn't matter if you're black, you're white, you're a man, you're a woman, you're young, you're old. It affects all of us.
In very personal ways.
People who have a mental illness are excluded and treated unfairly. And this is because people are afraid of mental illness.
In the long run, stigma produces a kind of isolation that grows from fear.
As a kid, my dad would vanish into the ether. No one said anything. I learned later, no one was allowed to say anything.
Silence helps perpetuate the stigma surrounding mental health and suicide.
The conversation simply needs to start.
When we just open up the conversation and begin speaking about it, it's amazing what can happen.
It's okay to talk about it.
Talk to others.
Talk about these things.
Talk out loud without fear.
Because as long as stigma exists, it prevents the society as a whole from incorporating these illnesses into a dialogue.
With advocacy, we can help educate, inspire, and inform people.
Okay, perfect. So again, that video is really about like taking away that stigma that's been woven into our dialogue, right, in our society overall. And so hopefully that highlights how we can use words that are, again, recovery focused. And as you can see, stigma is a barrier to recovery. And just to take a note, in that video, we heard a person refer to her loved one as someone who committed suicide. Even this term can sometimes be seen as outdated or stigmatizing, right? So we're using already in that video outdated language, and we'll discuss this a little bit more later on.
Hello.
So before we go further, maybe we should discuss what recovery is. And sometimes we think about recovery as a destination, a place where there's no more illness, no more symptoms, no more problems, when in fact, recovery is simply the ongoing journey towards wellness. So recovery can be defined as living a satisfying, hopeful, and contributing life, even when there are ongoing limitations caused by mental health problems and illness. So in Alberta, we have a guiding document that states recovery is a journey to improved mental and physical health, better relationships, employment, community participation, social inclusion, greater cultural and spiritual balance, and engagement that improves quality of life for not only the individual, but also their family and community. So recovery means different things to different people. It is personalized and diverse, and there are just a few examples of treatment, therapies, and communities or strategies that someone may engage to support their own recovery. As with every life journey, not every individual has the same recovery goals. So for example, in the area of substance use, recovery for one person may mean abstinence, but for another person, it may mean that they want to continue to use the substances a little bit more safely so they can contribute to striving for a life of meaning and contribution. So one way to enhance a person's safety when they live with addiction or mental health concerns is through a concept called harm reduction. So enhancing safety through harm reduction practices is something that we all engage with every day. And so some ways we all enhance safety includes things like the use of seat belts to reduce harm from car accidents, masks to harm from viruses or infection, right? Sun protection to reduce harm from the sun's rays. And of course, our day is filled with hundreds of forms of harm reduction practices. They are part of our homes, our laws, our lives. It just makes sense. So whenever someone is on their recovery journey is still facing risks that are related to their substance use or their mental health challenges, we can use harm reduction principles to enhance safety so the person can stay alive and continue working towards their wellness and recovery goals. So we find ways to reduce risks around their addiction or mental health issue and find ways to increase the supports or protective factors around them. So here are some examples of someone that you may be supporting or your own recovery journey or the recovery of others around you through harm reduction practices. So with substance use, we can identify and increase supports around vulnerable moments, find and access available treatments, right? Meet our needs around physical health, housing, food security, healthy relationships, use safer substances, reduce the amount of use, maybe reduce the frequency of use as well. And lastly, monitor use and impacts. So when we're looking at mental health challenges, we can try to find ways to identify and increase supports around vulnerable moments, find and access available treatments, right? Again, meeting the needs of housing, food security, using safer coping strategies, maybe even reduce the intensity of thoughts or feelings. Again, we're going to monitor symptoms as well. So with that, a quick question for everyone, a true or false question. And if you can share in the chat, I'm going to read it out here. So describing someone as high functioning is consistent with recovery-focused language. Is that true or false? Feel free to share in the chat and we'll look at the answer in a few seconds. So true or false? Describing someone as high functioning. It's a bit of a tricky one. Like, yeah, true, false, yeah, perfect. Excellent, so let's take a look. So the answer is false. So labels like rather like high functioning can be judgmental and can dismiss the person's lived experience or struggles. But people can appear to function well in some areas, but still have significant struggles in others. So this statement can also stigmatize those who may have struggles that are more visible. And we want to ensure that language we use encompasses the day-to-day realities of living with a mental health or substance use challenge while being optimistic and hopeful. All right, let's take a look at another true or false statement. So recovery-oriented language emphasizes hope, empowerment, and self-determination. True or false? Okay. Boy, everybody's very quick today on using the chat. Probably the fastest I've ever seen. Yeah, well done. A few more seconds and we'll take a look at the answer. Okay. So the answer is, it's true. So recovery-oriented language encourages a person to have hope and feel empowered in their recovery journey. Right? So being mindful how the language we use is and how it's read and what is shared by others and even heard by people around us. right, can again be impactful. Appropriate language is a vital component of communicating and establishing a sense of self-determination. So if the wrong words are used, feelings of powerlessness can be overwhelming, especially when decisions about things are important to another person, right, can seem to be or in the hands of others, right? So keeping in that mind that we want to emphasize hope, empowerment, and self-determination. So our approach to language should take into consideration where someone is in their journey. So this may fluctuate or be episodic in relation to their physical, mental, and social and emotional well-being. So we can use harm reduction principles, as I was talking a little bit earlier on, to enhance safety and to increase hope in a person's recovery journey, right? At any point in their recovery, their journey to recovery. And so, and hope is the foundation on which journey of recovery is built. A great quote from the Mental Health Commission of Canada. So with that, I'm going to hand it over to Kathy. She's going to continue to talk about recovery-focused perspectives and language that we can use in times when we're talking about mental health and addiction. That is, again, recovery-focused. Thanks, everyone.
Thank you, Anissa. So again, anytime that we hold hope, we hold that space for potential of increasing wellness and supporting recovery when we're thinking about substance use and mental health, we are supporting that focus on recovery. And with a recovery focus, again, it's not about reaching a certain destination. It's about not writing people off, even if they've had complex challenges and even if they've been impacted by illness or by these things for a long time. Mental Health Commission of Canada has identified 6 dimensions of recovery-oriented practice for care providers, and these can be considered by everyone when you're providing support to someone in their recovery journey, or even, thinking about your own care. We want to think about creating that culture and that language of hope, fostering an environment of hope, and where optimism is integral, encouraging that belief in the possibility of wellness or improvement or purpose, all of that. We got to recognize that recovery is a personal journey. It's unique to every person, it's individualized, and it's got to emphasize that person's strengths, their autonomy, and as Anissa said, that self-determination. Recovery also, we have to keep in mind that context of a person's whole life, understanding that recovery is affected by and influenced by a lot of different things, including relationships, community, and social determinants of health, like housing and food security, and all those things. They're all going to play a part in that recovery journey. And with that, we need to respond to the diverse needs of everyone. In Canada, the Mental Health Foundation or Mental Health Commission of Canada says that we want to ensure that any recovery-oriented practices that we engage in, that we want them to be inclusive and responsive to diverse needs of all people, including all cultural things, social and individual needs of Canadians. We also, in Canada, really want to be sure that recovery-oriented care or recovery-focused care is collaborative with First Nations, Inuit, and Métis people to provide that culturally appropriate and respectful care. Recovery is also about transforming our services and our systems, promoting that systemic and organizational change that support recovery at all levels of services. And so these dimensions really can provide a framework for implementing recovery-oriented practices across various settings and can even guide us with more intention as we support recovery journeys. As you saw, that first dimension of recovery-oriented care was to create that culture and that language of hope. And so recovery-focused language, which is really what we're talking about today, it's language that is person-centered, it's not discriminatory or insulting, it doesn't equate a person's diagnosis with their identity. It really emphasizes abilities over limitations. And when talking about suicide, it doesn't speak about suicide as either a crime or something successful or not successful. Let's look a little bit more at this. If recovery-focused language supports hope and possibility, problem-based or deficit-based language does the opposite. It defines people by what's wrong with them, or it reduces them to the labels or a diagnosis or to particular behavior or that specific challenge. We've already looked at some examples of problem-based language. Thanks so much for sharing that when we talked about stigma. So on this slide, we're going to see some statements that are not recovery focused, that do increase stigma. And so as we look at these, we also remember that problem-based challenges also ignore systemic or cultural barriers and may reinforce things like racism, colonialism, homophobia, ableism, sexism, and judgmental views around the challenges around poverty. And so with that, I'm going to ask you if you could put in the chat, maybe I'm going to show you some phrases, maybe put in the chat something we could use that would be more recovery focused in our language around someone. So if we saw someone and somebody said, oh, he's an addict, you think of something else that could be said that's more recovery focused around someone. If you see if you can think of anything. Put your thoughts in the chat. He's struggling. Yeah, sure, that could be happening. Yeah. He's working on himself. He's someone with substance misuse struggles or substance use, they're using substances. He could use some support. Yeah, let's take another one. They're mental. Again, we heard that in that video. People said they hear that all the time. A lot of these phrases that you said could also apply here. They need help with healthy coping skills. They think differently. Yeah. Right. Some of you may have heard the term like neurodiverse for people with certain things like ADHD or autism. The person could use a friend. I think these could apply to all of us here. Yes. Let's look at another one. She's bipolar. Oh, they have a different perspective. Yeah. She lives with bipolar disorder. Do you see that little difference in the shift? We're not taking that person and going, they are their diagnosis. They live with that diagnosis. Her journey is different than yours or mine. Absolutely. Seeing that person as an individual. Here's another one. She is refusing treatment. You know, sometimes we'll hear language like, oh, that person is, you know, they don't want help. I'm working harder than they are. Which is all stigmatizing. She's refusing treatment. I know this was for the last one, but somebody's saying her journey is different than yours or mine would also apply here. We all need to be able to find that right journey of recovery. That person doesn't think anything's wrong with them. Yeah, they're deciding on their own mental health journey. They haven't found services yet to meet their needs. Yes. Thanks, everybody. Here's another one, last one on this slide. They tried to commit suicide. Now, we heard that language in that other video. Can you think of other language that doesn't maybe talk about suicide as something like a crime that we commit? Any thoughts around this? Well, I'm going to let you think about that more. I'll give you some examples here. Oh, they gave up hope. Yeah. Acknowledging kind of those feelings behind what they're going through. We could say things like, instead of he's an addict, he uses substances. Instead of they're having mental health challenges. Instead of she's bipolar, we could just say her name's Jane. Like we don't have to label people by their diagnosis. We can see them as individuals. Instead of she's refusing treatment, well, she wants to use her current coping skills. Instead of speaking of suicide as a crime, well, they tried to commit suicide, or as a success, they had a failed suicide attempt. Let's just acknowledge what happened. They tried to take their own life. Yeah. So there's lots of different ways that we can find language that is more person-centered, less problem-focused, and looks at the individual and the complexity of their struggles. Shifting our language, it makes sense, but it's not always easy, and we know that. We're going to get it wrong sometimes. It takes effort, and it can be frustrating, and we're going to make mistakes as we go. We may remember when certain language, if you're old like me, you might remember when certain language that's now considered inappropriate was just a part of everyday life, right? And maybe sometimes we hear people say, I think everybody's being a bit too sensitive. It's not really a big deal if we use that language. But when you think back and you remember the power of our words, especially with our most vulnerable people, we can see that changing our language, even if it takes effort, it's worth the effort. Stigma can actually end with us, And so if you notice yourself having a hard time or even some strong feelings around language, then maybe you can approach your own journey with a compassionate lens Acknowledging that we're going to have natural biases that come up, that maybe it requires a bit of honest personal reflection, and that changing our words, it does involve effort. It will take time and it takes some humility. But using language that is responsive to new research, to new understandings of these things, it's an ongoing process for all of us. We are all learning and maybe unlearning together. And so having a recovery focus doesn't mean we're going to be perfect, but it's about holding hope that we can learn and we can grow to become more compassionate, more adaptable, more responsible. And it's about progress, not perfection. Recovery-focused language comes from a supportive place where before we even say any of these words, we try to consider the perspective of the other person. I wonder what this person needs right now. I wonder what's making them feel unsafe or what their challenges are. I wonder what's important to them. I wonder how I could be of help. And we don't find these answers to these questions based on our assumptions and our belief. We find out the answer to these questions by engaging in conversations and through listening. Curiosity and showing our openness, that's a way we show care. Less labeling, more listening. Recovery-focused language is inclusive because it seeks to respect the dignity and the autonomy and the lived experience of others by using words that reflect hope and self-determination and personhood. And we have clear conversations. We want to avoid jargon, and we want to highlight strengths and possibilities as defined by the people who have the addiction or mental health challenges. And this directly reflects the principle of nothing about us without us. We want to ensure that language that we use in caring for others is shaped with the people that it describes, and it's not just about them from the outside. And so this isn't just about how we use language in our words, in our conversation, but how we write as well. Emails that we send to a child's teacher, documentation or case notes that we put in our clients' files, notes we leave for our partner. Our documentation, the words we write even, tell a story that other people are going to read. And so good information and good documentation reflects and honors the voice and the perspective of the people we care about. So here's an example of maybe, let's pretend it's a case note, some documentation from a mental health worker. Can you think of a way that maybe this statement could be more strength-based, more recovery-focused? Put your thoughts into the chat. So this says, the client continues to miss appointments and is resistant to supports. Anything, if anybody here's a mental health worker or a housing worker or works with children and has to do documentation around the people they serve, what can we say instead? Any thoughts? We're hoping to provide positive support. Yeah. Right. There's different ways that we can approach this. We might need to revisit how we book appointments with this client, right? Current supports have to be evaluated. So again, with that, you're just shifting the focus from what is that person doing wrong to how can we adapt our supports to be more helpful, more accessible. Client may need to revisit current supports to adjust to something that works better. Okay, you understand. You understood the assignment. Here's another example. Client has faced challenges in attending appointments. More engagement and collaboration may help identify needs and accessible support options. All right, let's do another one. Here's an example of a note between a parent and a child's teacher. My son is really anxious and can't handle being in class. He falls apart every time there's a test. I know as parents, we sometimes get very worried for our kiddos and we don't know what to do. And we kind of speak about them in this way. But can we think even here of any way this could be a little bit more strength-based, a little more recovery-focused? Put your thoughts in the chat, by the way. We need to identify what is impacting his confidence going into tests. Yeah, it's that collaborative approach, right? Where you're looking for how can we support instead of seeing the son as being someone who's got this, insurmountable problem, or it's, all on him. It's seeing it as an indicator of let's come together and let's find ways that we can find more support. Yeah. So here's another example of that. My son is working on managing his anxiety and does best when he knows what to expect. Can we talk about ways we can better support him? right? Somebody else put in the chat, can we put some supports in place when there's an exam to help him succeed? Yes, you get it. Let's do one more. Again, it takes effort, doesn't it? It has to be intentional, but we can get better with this with time. So here's an example of an email from a worker to their supervisor. John is always overwhelmed and can't keep up with deadlines. It's hard to rely on him. Okay. Can you think of any way that this could become more strength-based and recovery focused? We're talking about a colleague. Let's ask John how we can better support him. That's for sure. Again, seeing is there something we can do to improve things? John may have an overwhelming workload currently. How can we help to support him? Yeah, absolutely. So we're thinking of things. We're not dismissing the problem. We're not saying that just everything's fine. We're saying there's something here, but we're trying to find solutions and supports. John has a lot on his plate, and we may need to send him a friendly reminder. Or let's look at John's workload and expectations to see if there's a way we can help prioritize. Again, we're looking at the complexity of the situation and not assuming that we know what John needs, but going, something's going on here. How can we provide support? Okay. Thank you, everybody, for sharing that. Here's another example. John's been doing a lot lately and may need some flexibility or check-ins to stay on track. So we're just going to we can bring issues to the attention of those that we work with, but we're going to do it in a way that's acknowledging some of the struggles, and then also involving that person in trying to figure out what's going on and how can we move forward. Thanks for sharing, everyone. Oh, there's another one. Sorry, I got ahead of the game. And something came up in your stigma language. You're so depressed. It's like you're not even trying anymore. Maybe you've heard this from somebody else in your life. Can you think of a way this could be more recovery focused? What's going on? How can I help? Yeah. Right? It's just opening it up for that dialogue. Do you need to talk? I see you're not at your best, right? I'm noticing that you can be very specific about things that we notice as well that would give us that feeling that they're not at their best. I see that you're struggling. Is there something I can do to help? Yeah. Right. So let's look at an example for that one. I know you're having a hard time and doing what you can. Is there any way I can help you feel more like yourself again? Again, when it's somebody that we care for, we want to try and be specific. I noticed that, you know, you've been wearing the same clothes for a few days, and that's not normally what I see in you. Or usually you like to tell me about what's going on at work, but lately when I've asked, you haven't really responded. And so I just want to check in. Is everything okay, or what's up? Right. So again, it's just, we're not saying, I see you're depressed, I'm going to label you right away. But something's different here. And I have come from a place of concern and care. All right. So with this one, I'm just going to ask you a question. Put your thoughts in the chat. Which of the following phrases aligns best with recovery-oriented language? A, the patient is non-compliant with treatment. B, she refuses to take her meds. C, the person has chosen to explore other treatment options. Or D, he's being difficult about his care plan. After all that discussion we had, this one should be easy for you. That's right. Everybody has selected C, right? Where that person has, chosen to explore other treatment options. This language aligns with that empowering language where we're empowering that individual to make decisions for themselves. And our approach to language needs to take into consideration where someone is at in their recovery journey. And so this may fluctuate in relation to their mental health, their social and emotional well-being, all of that. So we would acknowledge that that person has that choice to go forward in a way that works for them. Here's another one. Which statement below uses a recovery-oriented language or recovery-focused language? He's a schizophrenic, so he'll always need supervision. She may never recover fully. Mental illness defines who a person is. With the right support, people can lead meaningful lives. Put in your thoughts in the chat. Again, ding, 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 ding. You've all got that right answer. Of course, the answer is D. With the right support, people can lead meaningful lives. And again, that's even with people who are still using substances, people who still have mental health challenges. With those supports, they can still lead purposeful and contributing and meaningful lives. So here's just some final thoughts around using that recovery focused language, things we want to keep in mind. We want to use language that really honors that person. So we want to put the person first. So again, like it was mentioned before, we might say somebody is, instead of calling someone a schizophrenic, we might say that person living with schizophrenia. People, though, are more than their diagnosis. We want to keep that in mind. We want to avoid defining someone by their condition. We don't want to say, oh, he's an addict or he's an alcoholic. We use terms like a person in recovery, a person who uses substances. So we can find ways to, again, give that little bit of separation and see the person as a person first. We want to speak with respect and not pity. Avoid saying things like, oh, he suffers from that, or a victim of. How about living with that or working through that? And again, hope was a huge part of this type of recovery focused language. And so words like, they're getting support, they're in recovery, they're on their journey, those types of phrases show that we're holding that space open for change, that change is possible. We also can just simply ask someone how they want to be described. So some individuals do use identity first language where they identify with the culture around a certain condition that's focusing on their unique abilities. For instance, someone might refer to themselves as an autistic person, right? And again, they can use that language for themselves. And so we are going to respect how individuals describe themselves, but when in doubt, we're going to ask because everyone's journey and identity are unique. With that, then we're also going to use language that reduces some of that stigma. We're going to avoid those labels like crazy or junkie. I mean, even casually, these terms reinforce harmful stereotypes. So even when you're by yourself or you're talking about someone and that person isn't there, let's try to watch our language so we get in the practice of removing that stigmatizing or dehumanizing language from our vocabulary. We want to focus on strengths and progress, instead of saying, oh, they're still struggling. Let's even then try to go, well, they have been taking small steps forward. I can see they've been making efforts. They've been trying. Let's use non-judgmental language. We can say that they're choosing not to use today instead of, although they're staying clean, right? Because that idea of people being clean or not clean, that can imply shame, so even that we can say they're choosing not to use right now. We want to avoid all or nothing thinking. Recovery isn't linear. It doesn't always involve abstinence. It doesn't always involve having no symptoms. So phrases like, well, they're cured, or they don't drink anymore, or phrases like, they're doing better lately, or they're finding ways that work for them. They're coping in ways that work for them right now. That it can be more supportive and less of that all or nothing. It's one way or the other thinking. And again, we're going to try to think about and speak about mental health issues and substance use issues around, the behaviors that are with them, but we're not going to make those into character flaws, or even, when we're talking about somebody, let's say, we wouldn't say, well, that person, because of their substance use issue, because of their mental health issue, they are so manipulative. Like this is a personal thing that they're doing against us. Instead, we could say something like, yeah, that person, they're really having a hard time asking for what they need, right? We can find ways to even see those tough kind of interactions as we can come from that strength-based perspective. And just a few more tips for using language that builds connection. Let's validate efforts and not just outcomes. We can say, I really see how hard you're working at this and how difficult it's been for you. And listening, around what somebody's sharing about their recovery journey, that means focusing on more than just the results. If they didn't drink or they did drink or they were taking the meds or not, let's look at the different ways that people are making the effort. We try to be curious and not critical. And I know that's hard sometimes, especially if we're tired in the way that we provide supports to other people. We're feeling stretched, or we don't understand why someone made one choice over another. Let's step back and go into that place of curiosity. Instead of saying, why haven't you gotten help yet? We could ask, okay, what's going on for you right now? Or what's has been helpful for you lately? Or what would be more helpful to you now? We want to use that shared supportive language, instead of saying, well, you need to get better. You can, offer our support, let's try to figure this out together and show me how I can be of support to you. Let's have collaborative conversations rather than giving advice or direction or telling people this is, a real problem. Let's have an open dialogue and ask that person how it's impacting them or what matters to them, what support looks like to them, and let it be a truly collaborative conversation. And in all these conversations, we're going to lead with compassion. You don't have to have the perfect words. Communicating from a place of care and respect always matters the most. So we're going to watch a real short video here. I think we've got some time, and then we'll wrap it up.
Recovery language is the language we hope that everyone will use one day. Because recovery language is about more than just behavioral health. Recovery language is about creating an environment that allows all of us to be fully recognized as people. When we talk about recovery language, frequently what comes up is that it's language that puts the human and the person before the diagnosis or the label of any kind. Oftentimes, when we see people referring to politically correct language, they're talking about something that's being forced upon them. The reality about recovery language is that it's something that we can all choose to use. One of the things that I frequently tell people when I'm discussing recovery language with them is to think about it this way. If I choose to use a particular word, derogatory or demeaning, regardless of my intention in using that word, it's going to start to frame the way I think about the people or the things to whom I ascribe that word. But if I make the conscious choice not to use that language, slowly it's going to start to alter the way that I think about things. Because the words that we use frame the thoughts that we have. And our thoughts and our thinking, that's what creates the way that we act. And how we act, that's how we are in the world. That's the world that we create around ourselves. So when we choose to use recovery language, person-centered, hope-filled, non-stigmatizing, we are changing our own way of thinking and, hopefully, bit by bit, changing the world that surrounds us.
Again, we want to wrap up with that thought that recovery isn't a straight path. As with the rest of life, it's a journey. It's going to have ups and it's going to have downs. There's no single path to recovery, but every path to recovery does begin with hope. And so we can reduce stigma and foster this hope through the language that we use when we turn it towards recovery. And so with that, we just want to let you know there's some resources here where you can get more information about recovery-oriented care, especially the Mental Health Commission of Canada has a lot of information on that. And then there's also some numbers on your screen if you want some extra support around addiction or mental health, or numbers to call to learn more about how you can support those you care for with more recovery-oriented supports. You can give those numbers a call. Thank you so much for joining us today.
Thank you so much, Kathy and Anissa. This was such a great session, like always. I hope everybody got a lot of takeaways out of it. I know I sure did. This is such an important conversation to be having. So, we're seeing this language start to happen, and, it's like the start of the movement to use better, more compassionate language. That's really what it comes down to. So I will wrap this up real fast because I realize we're a minute over and I want to respect everyone's time. So I just want to say thank you. Thanks to everyone who joined us for the session, whether you're here live today or you're watching the replay. Note that will be shared with everybody who's registered, so you will get a copy in your inbox. Thank you again to our platinum sponsor, Ellis Dawn, for being here today, and the rest of our 2025 Lunch and Learn series, of course. We really appreciate the support. I'm just going to pop some links in the chat. I won't talk about anything too much, but we do have an event coming up next week called Highway to Healing, where we will continue the conversation on mental health, specifically really getting into mental illness and addictions, and just destigmatizing everything to do with that, with 4 wonderful panelists that all have lived experience. So check out the link if you want to learn more about that. Definitely sign up for our newsletter and social media to stay in touch and get, all the updates, future lunch and learns, programs, programming and everything we have going on here at the Mental Health Foundation. And once again, thank you for being here. There is that short survey that will pop up as soon as the webinar ends, so do please share your feedback. And enjoy the rest of your day and your weekend. Bye now.
Thanks, everyone. Bye-bye.